All right. So our question for you is, how do we use AI to best help us improve detection of rare diseases?
Well, I think currently, if we start off with what is the current status of how we detect disease, rare diseases in particular,
Mhm.
a lot of it is dependent on patients actually feeling something, symptoms arising, or in the hospital, we happen to catch something because we looked at it or it was by a fluke. We could probably do better. The issue, though, is a lot of people who actually have symptoms will go to general practitioners or family doctors or non-specialists.
Mhm.
And because the conditions are rare, clinicians don't often see these conditions, so they're missed. And the rate of miss of rare conditions is actually quite high.
Mhm.
If we had all the information at our fingertips, we were properly trained to identify these conditions, our detection rate would be much higher.
Definitely.
As humans who actually have limited cognitive ability in terms of, look, we're trained to do X or Y, we don't know what we don't know, and we don't have access to all this data, it becomes really hard, and that's why we miss a lot of rare conditions. The promise of AI is to be able to leverage incredible data resources to be able to process that information really quickly and look for those outliers that it's trained to look for and be able to detect rare conditions at a much higher rate than we do currently. The challenge is here, though, of course, where's that data? And oftentimes in Ontario and Canada, for example, it's the pseudo universal healthcare system. The government holds that data.
Mhm.
And is it being used for these purposes? Not really. There are hospitals like CHIO, for example, who have developed something called ThinkRare, which actually does routinely screen for data to actually identify rare conditions. Can we do that at a provincial level? Can we do it in collaboration where industry works with government to access these data, or do it in a way that everybody's happy, where we can detect rare conditions a lot better than we do currently? Absolutely, I think that's the way to go. Because of these vast data repositories, AI becomes a natural fit to detect these conditions.
Mhm.
Um, and I would say these partnerships between industry, between government players, between clinicians and healthcare systems is critical. And I would invite people, if they're actually interested in this, to connect with me, because I think we could advance this space considerably if we all work together.
Great. And what would be the best way to contact you?
Email.
Okay,
Yeah.
perfect.
All right.
All right.
Terrific.
Thank you.
Thank you.